want to get through this for you. So here we go, PNR 204, exam 3. Know that you have this exam, and then you have a HESI. I do have some good HESI information set out for you. And also, Professor Stiles does weekly groups, and she also does hands out information. So you've got a lot of good stuff to help you through. So exam 3. This is now chapter 25, which is your respiratory. So let's go over terms in respiratory. Now, atelectasis. This is when the ends of the lungs, called the alveoli, collapse. This is because you're not deep breathing and coughing, usually postoperatively or if you're on bed rest. Coryza is you and me, common cold, blowing your nose, cold fevers. Allergies is there is no fever with this one, okay? And with this one, all you have is the runny eyes and you have a runny nose and you're sneezy itchy. That's allergies. So that's not a common cold. Now, stridor is when you try to breathe air in. This is what we see in croup, all right? The upper airway gets swollen. So it's that type of air trying to get in during the inspiration stage, okay? Do not take and confuse that with that expiratory phase, which is always asthma, though, in the end, where you can hear the wheezing at the end of a breath. Now, surfactant is something that the body forms before birth. After 34 weeks of gestation, this surfactant holds the lungs open. The alveoli, it gives it that little support bridge. Before that, they're collapsed. They're not usable for working outside the body yet. But at 34 weeks, surfactants form, it holds those lungs open. Tachy anything is something fast. Tachypnea is an elevated heart rate, respiratory rate. Apnea is you're not breathing, okay? So pnea is something to do with respiratory. Dyspnea, difficulty breathing. Ventilation is just breathing in and out. Now, in your body, in your blood, you have erythrocytes. These are your red blood cells. And what they do is they carry oxygen to the body because they need to breathe, all the cells. And then the byproduct, carbon dioxide, is carried back to the lungs and they're exchanged. So erythrocyte, red blood cells with O2. Now, children are a little different with their O2 saturation levels. We will accept greater than 90%. In adults, we might say 92%, but children is 90. Now, signs of respiratory distress. There's your Selectol right there. Absolutely a big concept with respiratory. Tachypnea, you're breathing fast. I'm in distress. I'm going to have some noise in my lungs, rales, fluid, mucus, or just tightness, rales, rhonchi, wheezing, stridor, in, out, right? Or all that noise. And then, of course, because you're having respiratory distress, you're using all your accessory muscles, whether it's supraclavicular and you see that little space right here between the clavicles, right there, sucks back really hard, or, intercostal in your rib cage, pulling, pulling, pulling. And then, of course, any respiratory distress, there'll be some cyanosis of the nail beds. And because oxygen's not getting to your brain, some mental irritability and confusion it can happen if we don't correct that respiratory distress. So that's a perfect question for Selectol for you. Now, acute pharyngitis, sore throat, most of them are viral. Um, Sometimes we will culture them and because they're continuing or just to be sure, and then we can find strep. We know strep does a lot of different things, can cause more problems if we don't have that child take all the medication. So prompt treatment of strep, it's will prevent serious complications like rheumatic fever. It does heart valve damage, that carditis, inflammation of the heart, if we don't take all of our medicine and get strep, which causes rheumatic fever. Glomerulonephritis, the kidneys stop working and you're not producing urine. Peritonsillar abscess. These things are huge. They can't swallow, and their breath is just full of infection. You can smell them just by breathing. Ear infection, all this upper airway stuff goes up the eustachian tubes into the ear, goes into the mastoid glands, which is in the neck, and then it can get in to the central nervous system, into their meninges, which of course then it's strep, meningitis, bacterial, very serious. Osteomyelitis, it can get into all the bones into your head, right? And it can cause an osteomyelitis. We don't think about that one. Remember, you have sinus bones here, and all of that strep can get in there. And then, of course, strep pneumonia. Again, that's another good select all. What can strep cause if we don't give prompt treatment and complete treatment for strep throat? Remember, any upper respiratory, any thing that causes a fever with children, remember, like the flu's going back around. Small, frequent amounts of their favorite fluids. You have to replace the fluid that they're losing with sweating, with fevers, okay? Prevent dehydration. It's extremely serious in children. You don't want them dehydrated. Bronchiolitis is another name for RSV. Okay? You think RSV, you think, oh, the baby's sick. Well, babies are sick. Now, this is usually about 6 months to 2 years old, and it's because it's hard to suck, swallow, and breathe in the small children. Actually, this is actually coryza in old people because it is a common cold again. It is a virus, but little kids don't tolerate it well. Asthma. Asthma is a chronic respiratory illness in children. It is one of the principal causes why children miss school, why they go to ERs and they go and are hospitalized. Asthma. And again, it's due to allergen and it is breathing, so they got to treat that. And it is that frequent cause of school absenteeism. So laryngotracheal bronchitis or croup, again, it's that inspiratory stridor. It's all upper airway. Now, if we don't treat croup, and this croup was caused by H. influenza, it can swell up the epiglottis. And that covers the larynx, which means you're not breathing. This is a life-threatening emergency. This is something that you would need an airway at the bedside for the doctor. So if you suspect epiglottitis, make sure that you have an intubation tray or a trach tray at bedside because it's covered the larynx. They can't get air in there. Cystic fibrosis is two different organs, multi-organ problem. It's genetic. Mom and dad give this to their child. Now, it's all about mucus. So we have mucus that obstructs the airways, okay? And then we have enzymes that in the pancreas that aren't secreted. And now you have really bad, poor nutrition because your body can't digest it. So, what are you going to see? Now, with that enzyme, they're not getting fat in their body. Because they're not getting fat, what's happening is they're losing stools and they're bulky, foul smelling, and they're frothy. They also sweat out of their pores sodium, salt. It's one of the ways that if you suspected cystic fibrosis, you would say to the parent, I mean, if they want to, they can lick the skin They literally will taste high level salt. So this is a child that's going to need high protein and so high sodium because they are not getting fat. They need good nutrition and they need to replace that sodium. So there's electrolyte imbalances with this child. Now, the third thing is infertility, and it's actually the man. The woman can get pregnant high risk. The man cannot impregnate the woman. Something with mucus in the vas deferens, and the sperm can't get to the mother to make the baby. Now, believe it or not, 1 year post bilateral lung transplant, a man can get his woman pregnant. So that's just, for you to know. Now, the heart. I think the heart is a pretty neat little thing, isn't it? It is the first body system to function in intrauterine life. And if you know what goes on with it, it starts out with a stalk and it turns and it twists and it comes up and on each other through that first little bit of amniotic life. It's quite amazing. So it's amazing more hearts aren't built wrong. So let's just go into some diagnoses about that. Again, tachy is fast. So it's an elevated tachycardia. That would be elevated heart rate. Rady is slow. Bradycardia, slower than normal heart rate. Dist, that means a difficulty, abnormal, something's dysrhythmias, something's not right. Could be the rhythm. You could hear even different sounds. You could call them dis in some ways. Now, hypoplastic, we usually refer to the ventricles, and it's usually the left ventricle that's small and complete and doesn't work. And we call it a hypoplastic heart. And if it's the left ventricle, it's hypoplastic left heart syndrome. Right? Now, a shunt is an opening between two things that there's flow that goes back and forth. It could be there's a hole between the upper chamber of the heart and it's shunted left and right. Okay. Shunt. It's the way the blood flows. It should come down that left atrium into left ventricle. But if there's a hole, that difference is it goes left atrium. Oops, let's go over the right atrium. Let's go back around again. That's shunting. A murmur is something where the blood flow, where you can hear if the valves are opening and closing right. Usually, a murmur, a heart would be cha-ching, cha-ching, cha-ching. When there's a murmur, you're going to hear. You see, it's not that crisp and clear sound. It's not closing. There's blood flowing back and forth. It's not correct. And you can hear that really well. Cyanotic is when you're not pink and beautiful and you're, a little bit blue. That means oxygen saturation is low. Acyanotic, A without, that means you're perfectly pink, perfectly normal saturation. And stroke volume is one of the heartbeat, the amount of blood that's pumped out. Now, I mentioned atrial septal defect already. It's that opening between the right and left atrium, and we know blood's going to flow to the right side. Think about how blood goes through the body, through the left side, and just gets back to that right side. So pressure in that right side is going to be decreased. So if there's a hole, it's going to go from the left side and go over to the right side. It's just what happens there. So what happens? Blood goes back into the right side and back into the lungs. So it's increased blood to the lungs because that's the way the blood's flowing. They can either do a cardiac cath or surgery with this. They're doing a lot more cath closures today than ever versus open heart surgery. Now, ventricle, same thing. We're going to see blood going back to the right side and increased more blood to the lungs, okay? Again, Most of the times we do because of that left ventricle and that heart pumping, that engine, they usually do surgery to try to close that ventricle. Many times they're today, depending on the size of it, they'll try to do a calf closure, but mostly surgery. Now, patent ductus arteriosus. This is a very difficult thing to understand. This is fetal circulation, and all it does, it connects the oxygen, the lungs, to the body, the aorta. And this is something that is there when mommy is pregnant with you. And usually about 21 days later, it's completely closed. Now, sometimes it doesn't. So we can do either surgery or just give medicine called indomethacin. Actually, indomethacin is an NSAID, and there's a liquid NSAID called indomethacin. Okay? We're going to be monitoring blood pressures on that child. Coarctation of the aorta. I used to love to look for these as a cardiac nurse. And how did I do it? Well, you do your assessment when your kids come into the nursery, and then you feel pulses in the upper extremities, the brachial pulses, radial pulses, if you can find them, are good. But you go down to the feet, they are decreased or non existent. That aorta coming off the heart, there's a kink. So the blood can't go down to the lower extremities, right? So blood goes back up. So you have high blood pressures up on the top, but down on the bottom, you don't have high blood pressures. They're going to be at least 20 millimeters of mercury or less. And that's how the final diagnosis is made. First feeling decreased pulses or none, decreased capillary refill, yes, of course. And then doing blood pressures, lower and upper, upper or higher, lower or lower. This is coarctation. Again, surgery or a calf is done. I've seen them both. Tetralogy of Fallot is on the right side of the heart. These are the things that you'll see with it. There's usually a hole between the ventricles. The pulmonary valve, which is that opening up into the pulmonary artery and lungs, there is an narrowing called a stenosis. Yes, the aorta is pushed over, called an overriding aorta, and occasionally that pulmonic valve closes for something reason. We don't know why, but a piece of tissue or it spasms, and no blood can go up into the lungs. You're now, and I have seen O2 sats go from 100% to 10 in less than 2 minutes. It's quite crazy, but it's tetralogy of Fallot. It's a tet spell. What you need to do and know is that you take this child, put them knee to chest. Older children normally, if they're standing up, will squat down on their knees, and that somehow changes pressure, pops open the valves, and lets blood go. Surgery is needed. Most are done as newborn and infants, but there are occasionally older kids. Hypoplastic left heart, just know that this is the left ventricle. It's underdeveloped, it's non existing, and we've got to do 3 stages of surgery to get this heart capable to get oxygen to the body. So it's 3 big surgeries on this one. So let's do some diagnostic tests. We're going to look at some signs and some complications. So how are we going to diagnose that coarctation of the aorta? We're going to do an aortogram. It looks at the whole arch, it puts dye in there, and we can see, oh, there's a kink. Or an echocardiogram. Sometimes we can see murmurs, we can see different weird structures in there, but the echocardiogram, after putting the kid on an EKG and doing our assessment on admission, we do an echocardiogram as much as quick as possible. Once we see something for that, they're going to go for a cardiac cath to look at it even closer. Now, you've got a child, heart's not working good, and it's going into failure, congestive heart failure. What are things you're going to be looking for? Well, if the heart is failing, the lungs are filling up with fluid. So this is that sudden weight gain. This is why we weigh our infants every day, usually on the same scale to be sure. And if we're seeing an increase of a half a pound, that's a lot of weight. And where is it? Listen to the lungs. Are they dyspneic? Or they're resting and their heart rate is 170, tachycardia at rest. Absolute signs of congestive heart failure. Breathing hard, tachycardic, and gaining weight. Now, some complications. We know that pneumonia, full of fluids, rheumatic fever. Remember, it's that heart valve. Remember, it's a 10-year course, right? And then, of course, we know there's meningitis, glomerulonephritis, otitis media, and that's all of your strep things that can be occurred. Again, it's off the other select all list. So early signs of congestive heart failure, something's going on. I've just mentioned it. They're laying there and their heart rate's up. Now, another thing with the dyspnea is you're sitting there and you're trying to feed them, and the heart's working so hard to work, it's really having a hard time swallowing, and breathing. So fatigue during feedings. Also, these children, because they're running a mile here, you'll see sweat on their forehead. But again, that biggest clue, that first clue, that sudden weight gain. So, nurses, what do we need to do to take care of this child who's very fragile and tires easily? Well, you're going to do organized care so you don't have to keep going back and bothering them. Let them rest. You're going to, if they're crying, feed them. Their feed should be small and more frequent, okay? Oxygen you can give to help them breathe a little bit easier. And then any other medications that they might give. They might give what, a diuretic, right? Depending, whatever. Make sure that again, with congestive failure, we probably just weighed them, but remember, making sure we weigh them tomorrow when they lose weight, making sure dosages are correct. And of course, anything that does with fluid, you're always monitoring, yes, daily weights, intake output. Rheumatic fever is due to a strep infection that wasn't taken care of. We mentioned all the other things it can cure. We know that rheumatic fever does a lot of things. It can, the heart, which is carditis, that is something that's caused by strep. It attacks the mitral valve and damages it if we don't get to it quickly. If we know that it's rheumatic fever, that heart valve is fine, we're going to be giving penicillin, and they're going to be getting it for 10 years, aren't they? So if we see them at the active stage of rheumatic fever, we're going to give them something for that pain and that fever. Remember, they have a sore throat, it's viral, they ache, they pain, it's that strep in there. It's like, oh, I don't feel good at all. So anti-inflammatory, steroids, aspirin. And of course, if it gets too far, we're going to do that management of cardiac failure. DASH diet, another great select all type question. Hypertension in children, we don't go immediately and stick them on medications. We go very conservatively. This is a child over the age of 2 that gets low fat. Remember, they need fat for their brains up to age 2. So low fat, fruits, vegetables, fish, poultry, and low sodium. This is the first time that you're going to see any diet limited in children. Hyperlipidemia. LDL is lousy cholesterol, and HDL is healthy cholesterol, okay? So hyperlipidemia, excessive lipids. Now, blood disorders, anemia. Most common of all childhood blood disorders, And we know iron deficient anemia is the most of all. Anemia means there's not a lot of red blood cells. Red blood cells are not carrying oxygen around. And you don't carry oxygen around, you're going to be tired, right? Your cells aren't getting what they want. There are types of anemia, acute or chronic, inherited, acquired. We have a decreased production or a decrease of loss, or, where they hyperproliferation, overproduction, or hypoproliferation, an underproduction. As I said, iron deficient anemia, most common of all the nutritionals. This peaks with toddlers. Why? Well, as infant, they were getting breast milk, they were getting iron fortified formula and their vitamin D. They for the breast milk, they were given iron fortified cereals. So they've gotten iron all the way up to about age 1. But as we're weaning them off these things, we're going to see them start to become anemic. We need to give them iron. Now, how do you give an iron supplement to children? Well, usually it is a liquid. The young kids, it's usually these toddlers I'm talking about, because we know toddlers are now at whole milk at age 1, right? There's not enough iron in there. There's none. So we can start the liver and the green leafy vegetables in them, but many times these children need a supplement. So it is a liquid. Hopefully it's through a straw, they can drink it. And it should never be with meals. It needs to be before meals. And never, never, ever with milk and vitamin C. Any juices, apple juice, orange juice, you can take it with that. Or water. No milk on an empty stomach because it needs the acid to digest, okay? Hemophilia is a hereditary blood disorder. The blood doesn't clot. You just keep bleeding, bleeding, bleeding. I already told you hyperlipidemia is excessive fat-like substance in the blood. Sickle cell, hereditary. It is a crescent-shaped cell. And the problem is these cells tend to get caught up in the blood vessels because of tiny little vessels, and it just gets swollen and it hurts and it pains. So what is our goal in a crisis? Well, we need to oxygenate, we need to hydrate to dilate the blood vessels, and we need to give pain medicine because it really hurts. Now, erythropoietin, we think about that with the kidneys, and we think about producing red blood cells. Erythropoietin, sometimes we can give them injections of it, but erythropoietin is used in the case of like sickle cell. The cells die off quick, and they're needing blood transfusions. Erythropoietin could help that. So it regulates red blood cells, is what we're talking about. Now, thalassemia, and we usually talk about major when we talk about thalassemia, is hereditary blood disorder where the body cannot produce sufficient adult hemoglobin. And it just bursts into the body system and iron and oxygen, and you have to live on uh, transfusions for life. But the body doesn't produce enough adult hemoglobin. Leukemia. This is where you have cancer of the white blood cells. Some of the things that we need to be teaching our parents is there is no white blood cells. There's cancer of them. The level is less than 1. It should be like 7. Well, these children, be very careful with immunizations, especially live immunizations, because during that time where they're severely immunosuppressed and chemo and stuff, it could cause them to have a disease. Also, if they're exposed to anything, they need to tell their doctor. Now, they're weak, they're tired, they're with the treatment, their blood counts are low, no oxygen in the hemoglobin, right? Blood counts low. And they just general malaise, and sometimes they have a lot of sores in their mouths, and it does cause them not to want to eat. So giving them some of their favorite foods in a manner that makes them want to eat, make a party out of it, whatever, or shape it like pancakes and like Mickey Mouse. I mean, those type of things that can stimulate appetite. Keep that mouth as clean as you can, and always look at their skin and mouth signs of infection and ulcers. And leukemia is a hard thing. Children go through a lot, and many of them don't want to talk to mom and dad because they have mom and dad are like dealing with working and them and the kids in the house, and they just feel guilty. They feel like somehow that child, especially young ones, remember, like preschoolers, which is age of leukemia, many of them feel like they did something wrong that caused it. So make sure you talk to your kids about their feelings. Now, GIGU, dysphagia. You can't swallow. Many conditions that cause that. Remember acetaminophen and poison control. This is the most commonly ingested drug with children. It causes liver toxicity and is extremely dangerous, okay? But it is commonly ingested. So GI disorders, it's fluid and electrolyte imbalances, and then there's also stuff with absorption problems, inflammation, etc. So let's go into some of these things. Pyloric stenosis is in babies, 3 weeks to 3 months. You guys did a discussion question on it. The food goes down, and the valve that empties the stomach into the intestines is swollen, and it doesn't let blood, food, milk to go to the body. And it fills up, and all of a sudden, it is projectile across the room, vomiting. Okay? It's not dribbling, spitting up, it's across the room. Diver, di Meckel's diverticulum, it's a little piece or tab that sort of bulges or outpatches in the lower part of small intestines. We actually would see bleeding with that. Bright red blood in the stool, actually. Appendicitis, very common in children. Remember, a ruptured appendix can cause a peritonitis. And they do need, even if it's ruptured, they need an emergency appendectomy, and they need to get all that peritoneal cavity cleaned up and washed out of all of the toxins. This child would have at McBurney's point, the right lower quadrant, pain and tenderness. We're going to be looking at inflammatory factors. CRP looks at inflammation, and a CBC, right? CBC is going to show us a white count, and the urine and stool and x-ray and CAT scans and ultrasounds. All of these things might some be done or all done prior to going to surgery. Now, post-operatively, our biggest thing is taking their vitals, monitoring their labs, giving the antibiotics because they're infected, pain control, and then slowly increasing their diet with it. Now, Hirschsprung's disease is usually in the large intestines. It is a megacolon. It's an obstruction. It means this Hirschsprung's is an area in the intestines where there's no nerves, aganglionic. No peristalsis is happening. You can stretch it and it's not going to hurt. There's no nerves. But you're going to see, as a sign of it, no stool. This is usually newborns at birth. Now, it might need a colostomy, take out that damaged piece of intestines to put it up to the colostomy to the abdominal wall, or sometimes they'll take and cut it out and join it up immediately. So it might go up for a colostomy and later on be put together, or sometimes they can do it all at once. Gastroenteritis, and this is your vomiting, this is your diarrhea. So, what's the most common cause of diarrhea? Well, they don't tolerate food. This is one of the things we look for with children when we're starting to feed them at 6 months. Are they having diarrhea? It's a food intolerance, all right? Overfeeding, mixing their formula wrong, and an ingestion of high amounts of sorbitol, and that's in some medicines that we do. That's actually in charcoal. We ever have to give it due to a poisoning that we're giving that. The big priority problem is all about electrolyte imbalance and failure to thrive. They're losing fluids, they're losing electrolytes. It causes severe dehydration. Now, one of the things with GI disorders, it's all about the vomiting diarrhea, fluid out, fluid in, right? How do we the most accurately measure fluid balance? Well, what this last sentence says. When they came in to the floor or to the ER, they were weighed. You're now treated them. They're going home. Is there an increase in weight? There should be. That means we've replaced fluid. So this is a great way to assess the dehydration and how far that you've come taking care of that child. Celiac disease is a diet where they can't have wheat, rye, barley, or oats. Now, they can have rice flour, but they can't have wheat, barley, oats, and rye. In fact, they're using different sorts of flours now like crazy. So we have much more at our fingertips for these. These children can have all the dairy, chocolate, fruits, vegetables that they want, okay? But no bread, no breading. Hernias are when your intestines pop out through somewhere in your tummy or your inguinal area. As long as you can take your finger and push it in and out, like I love umbilical hernias, taking my finger, pushing them in and out, well, they work really well. Well, if it starts not wanting to move and it's red, it's hard, and it's painful, that means it's twisted in there. Something's going on. It's called a strangulated or incarcerated hernia. The only treatment is to get them to surgery, and they'll go in and untwist it or remove or whatever they have to do. Now, acute glomerulonephritis, again, this is one of those strep problems where it hurt the kidneys. As I said, it causes them not to urinate, so they're gaining all this fluid, but one of the key signs is periorbital edema. It's part of it. And of course, they're pale and anemic, and again, treatment, treat the strep. Now, in chronic constipation, and you'll have children that are chronically constipated for many different reasons, increasing fluids is always number one. And then raw vegetables and fruits, not cooked, okay? Raw ones, and anything high fiber that you can think of. So we think that they're getting broccoli because we cooked it. Well, we're cooking out the fiber. Give it to them raw. Urinary tract infection, most common in little girls. They have a short, wide open little urethra. So that's how they get these infections. It's usually that front to back to front, wiping stuff and sitting in bubble baths that causes those things. So, how do we take care of this? Well, increase their fluid intake is always number one. If you see them, dancing and wiggling, well, get them to the bathroom frequently to make sure that they're in there and you're emptying their bladder. It is recommended for young girls to wear cotton underwear. And we know the cute ones are always not cotton, but it is the best thing for the child. Now, hypospadias is an interesting thing where in the male, instead of the opening for the urethra at the end of the penis, hypo, it's underneath somewhere. And that's all that means. It can be repaired using the foreskin. We don't cut that off. We have to use that for that surgery. It's a pretty big surgery, actually. Cricodorganism is when the testicles are not in the scrotal sac. It's one's up or two's up, one's down, two's down. Again, it hasn't fallen where it should go. Skin disorders. Well, impetigo, probably the most common that you see with children. My grandson got it. My daughter thought it was a mosquito bite that he itched too much, but it kept spreading. And I went, it's impetigo. Impetigo, very, very contagious. It's staph or strep, and it results in these juicy, bulbous lesions. They're almost like golden colored type things. Um, and it takes oral and topical antibiotics to get rid of it, to let you know. Ringworm is a fungal infection. Pediculosis is a lice infection. Eczema is hypersensitive skin, where the skin is always peeling and getting crusty and even breaks open and gets infected. It's can be very minimal or quite a lot. Fungal infections could be in the head, could be in the feet, could be anywhere, right? Pediculosis, head, body, pubic lice infections. Scabies, we think about that going to hotels, right? And it's underneath the skin and it's itchy, 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 itchy like crazy, and little red marks that you would see on the skin. And we give permethrin lotion, shampoo for those things. And then burns, remember, this is making sure that we don't have handles hanging off the stove. That's where they pull them off. I know my brother, that's the way he got his burn on his arm. The handle was there and he grabbed it off and it went on his arm. Remember the rule of 9 in hydration. It can be thermal, chemical, electrical, radiation. So keep those cords away, keep pot handles away, and keep anything that child could hurt themselves. Those young ones always worry about that. So with scabies, I know that they come into the ER and the doctor says, oh, they have scabies. It's like, oh, you always get worried. Did any come on me, right? But I've never gotten scabies from a patient, So you apply that permethrin. All the family members, the car, the home, everywhere needs treatment because they hide everywhere and lay eggs and keep growing. The linen and clothes should be washed in heat, dried in high heat, because it burns them up, gets rid of them. It's not just the antiseptic detergent, it's the heat that kills them. And then the toys and anything that you can't wash, put it in a bag for 1 week. It is a lot when your kid gets scabies in order to keep it out of the house. Remember the burns, like I was saying. The thing is that pulling cords and pot handles are the big thing. Whenever you're assessing anything with burns, always remember airway first, all right? You might see stuff on the chest. Planes could have gone up into their airway, all right? So always check for a airway. Patent airway priority, okay? When we are looking at a child with burns, remember they've lost moisture by the skin burning. So fluid resuscitation given accordingly. Monitor their urine color. It's going to tell you how dehydrated or not they are. Intake, output, skin turgor, lab values. Where are their electrolytes now? And then looking at mucous membranes. What's their lips? What does their tongue look like? And then skin, eczema, as I said, this is those allergies. And I just mentioned it to you. And it itches like crazy. Number one, hydrate it like crazy. If you take and put a lot of steroid creams on, remember that's all being absorbed to that child. So we try to hydrate, hydrate, hydrate. A little bit of that steroid cream on inflammation and, keeping it clean, free from infection. Acne should just be routine skin cleaning. These are your adolescents. Those greasy hair products and cosmetics should be avoided because it's just going to create more grease more acne. And the other thing is, we say routine skin cleaning. If you start to clean it, your face, let's say you're worried about your face, it can irritate the skin and actually make it worse. There are today all sorts of products out there and oral treatments available. Again, that's usually through the physician after we go through all of those, commercial stuff that we have. Some of those work well, but you got to find out what works for your child. And again, the thing with acne and doing a treatment that they need to follow the treatments as prescribed, not to overdo it, or because that's what usually a child would do. Thyroid dysfunction, hypothyroidism. Children need the thyroid hormone for cognition. They need it to be able to do gross and fine motor skills. Hypothyroidism in a newborn is dangerous. We usually would see it because they're not meeting developmental milestones, or we can see other things. One is actually constipation at birth, but hypothyroidism, there'll be delays if we do not get their hormones replaced. Diabetes mellitus. This is high blood sugar, and you have this insulin resistant. It means it's not working with the sugar. Now, children, you most always see type 1, which means you need insulin, right? Type 2 is usually adolescents, usually the overweight ones. And it can be reversed with diet and exercise. But children ages 2, 3, 4 that have diabetes, it's type 1, it's for life. What do you see? Well, they're going to be hungry, polyphagia, because they're not digesting sugar, so their body doesn't know it's in there because it can't use it. And then polyuria, urinating a lot, and polydipsia, which means I am drinking, drinking, drinking. Usually, what brings the child to the doctor is weight loss. They say, "Oh, my kid all of a sudden lost 5 pounds this week and looks pale," and that's what they usually go in with. And sometimes they're all of a sudden enuresis or nocturia, bedwetting at night that they've never had before. Usually one of the signs of diabetes. Another great select all here. Hypoglycemia, what do you see? Low blood sugar. You're not getting sugar food to the body, all right? You become irritable. Your body's hungry because there's no sugar. You're weak because there's no fuel, no energy. Decreased muscle coordination, nothing to fuel the muscles. You are confused. Your brain needs sugar to think, and then you'll be paler and you'll be sweating. So, what would you do for a child who's alert, who showing these signs and they're a diabetic? Well, why don't you give them some sugar, some quick source of sugar? If they're over the age of 1, honey is some great concentrated stuff, right? Sugar cube, if that's all you have, a little sugar candy, something, all right? But if the child is unconscious, not responding, don't put anything in their mouth. They're going to choke on it. That's when we do give the glucagon, okay? DKA, what do we see? Well, DKA is the body doesn't have insulin. So you're eating and your blood sugars are elevated because it's not being used. And then the body says, I'm hungry because the blood sugar's up, but it can't be used by the body, and starts eating proteins and fats. Byproduct ketonuria. So you're going to see ketonuria. Your pH, the blood pH, goes really low, and a decreased bicarbonate is part of it. Usually a normal pH is 7.45. Do you know what the lowest pH I've seen on a DKA child was? 6.89. And then we saved that child. We know that they're hypertonic hydration. That's all the sugar in there, right? So we need to dilute that quick. And these children, DKA, You can smell their breath. It smells like rotten peaches. It's fruity, sickening, sweet. That is that fruity breath. And they're nauseous. And because they don't have food, they don't have fuel, they have an altered level of consciousness. That's how you describe DKA. Remember, if a child with diabetes is going on vacation, they need to make sure they have their prescription supplies, that that child, if they're going to be separated at any time, that there's an alert somehow on the child, bracelet, necklace, phone, whatever, and any extra supplies that you may need in case there's an extended trip. Also, you would know, is there medical care around? Cushing syndrome is an overproduction of adrenal hormone cortisol. This is also when you take oral steroids, prednisone, too much for too long, and the body does not like it. So what happens is it causes protein wasting, which means you have skinny little arms, skinny little legs. Those muscles aren't, they're not working and they're just fading away, all right? Thin extremities. But the face and the trunk of this child are big and pudgy. That ruddy cheeks. Ruddy's a red darkened cheek. Ruddy means that red darkened cheek, that hyperpigmentation, it's called. Now, that is Cushing syndrome. How do we cure it? Well, we stop giving steroids and we taper the dose off. Now, diabetes insipidus has nothing to do with diabetes mellitus. Diabetes mellitus is the pancreas in the abdominal cavity. Diabetes insipidus is the pituitary gland, the posterior lobe. And all that little gland up there, pituitary gland, does, it says, do we drink and do we excrete urine? It's fluid balance. That's all it is. So when you have diabetes insipidus, you have something that's not regulating the urine and your thirst. So you have polyuria, polydipsia. Remember, diabetes mellitus has polyphagia. They're hungry because they don't have sugar. There's nothing to do with sugar with diabetes insipidus here. You're losing fluid like crazy. Drinking, drinking, losing, losing. What is what we need to do? Priority. Assess the current vital signs. Are we dehydrated? And then, of course, let's look, have we lost all our potassium and all that urination? So, types of immunity, you're either born with it or you acquire it. When you acquire it, it means that you've been given vaccines or serum. Okay. That would be your COVID immunization. You know, we got our vaccines. Active immunity, where you had chicken pox and now your body's produced its own immunity. And passive immunity, it's provides antibody to the person. It doesn't last all of that long. It would have to be off and on, you know, getting more immunity. But the most one that we talk about is acquired. Remember, there's always dosage calc. I've talked to most of you. You do have that. I do have a little refresher video there if you want to go back and look, if that's you. But thank you so much. I hope this helps you, and I wish you the best. Anybody who does need any help with dosage calc, just reach out and I will help you, okay? Have a good day.